Welcome to My Generation podcast brought to you by the South Shore Senior News. I'm your host, Steve Dubin. South Shore Senior News is a monthly newspaper that connects seniors and the sandwich generation on a monthly basis. This segment is being recorded and can be found along with other segments on southshoresnews.com. Today's guest is a longtime friend and colleague of mine, Rick Wolfert, Dr. Rick Wolfert, also known as the Toothboss, and we'll have him explain what the heck the Toothboss means, how he got there, and how he nicknamed his practice that. Rick is a graduate of the Tufts University School of Medicine, recently retired from the reserves as a colonel, and has been performing dentistry for over 30 years. He is the dentist to many celebrities and stars, including me and the publisher of South Shore Senior News, Tom Foy. Welcome, Rick, to the show.
Steve, thanks for having me on. I appreciate it.
Well, thank you for joining me. So let me start with the first question that comes to everyone's mind. What is a Toothboss?
The Toothboss came from my Navy days. So I started in the Navy in 1981, and I was stationed on an aircraft carrier about 1984. And I was asked to go to the meeting with the skipper of the ship because the department head could not go. So I went, and the captain of the ship didn't know me from Adam. So he's going around the room talking to all the department heads, and the guy before me was in charge of all the airplanes, and he's called the air boss. So when he came to me, he called me the Toothboss. And ever since then, it kind of stuck. And I decided that that's what I was going to call my practice. And it seems to be popular. People really like it. They think it's catchy. I ride around in my fleet with the Toothboss on it, my two cars. And I'm always getting stared and waved at. So I always forget that they're not waving at me. They're waving at the Toothboss.
And hopefully they're waving with their full hand.
Yeah, exactly.
Okay, right. Very good. And so let me jump into really the most critical part of this podcast, which is, in particular, what are the dental needs of seniors? What kinds of specific issues do they have with oral health?
Well, first of all, let me say that my parents gave me a healthy feeling about working with seniors. You know, I was the youngest of four. They were elderly when I became a dentist. So I always felt the need to manage older patients like I would manage my parents. And now that I'm elderly, I feel that way even more. So I feel like I have a good handle on what to do for seniors. We all know that the oral health is important, and it's connected to cardiac health, and just having good teeth is so important when you get older, so that you can get good nutrition. Having good teeth means you have to have good gum tissue health, and you can't get cavities. Unfortunately, the elderly are on a lot of medication, and those medications can dry your mouth out, which can also cause cavities. So there's a lot of issues that are going on with the elderly, as well as, unfortunately, a lot of retirees don't have dental insurance, and that precludes them, or if they feel like they can't go to the dentist. Well, it's probably the most important time to go to the dentist then, because you have these issues going on that you may not know about. Okay. So that's one of the reasons that in my practice we have a insurance plan that's geared toward the elderly. My Toothboss plan covers cleanings twice a year, and you get a 20% discount on any types of treatment that we do. Because a lot of the dental insurances that are offered to seniors are not very good and don't cover a real lot except a cleaning now and then. So I do have a healthy respect for seniors, and I want them to feel comfortable coming to my practice.
Okay. And so one of the things in particular that you help folks with are mini implants, correct?
I do some mini implants, but there's a qualifier to that. There aren't that many situations that I can use them for, but certainly if somebody has for example, a full lower denture, um, those lower dentures when we get older don't fit. They don't fit even when you're younger, but when you get older, your bone resorbs and there is nothing for them to hold on to. So sometimes putting in a couple of mini implants on the lower front mandible, it's a dramatic improvement in how they stay in. So I'll do those on occasion if they're warranted and if the patient's healthy. Sometimes, unfortunately, if the elderly are on multiple medications or they have some cardiac issues that are not controlled real well, it precludes me from doing them, but I can always find somebody that can put them in for them.
Okay. And then because of the specific needs of seniors, are there do you have tips for daily regimen to try to maintain whatever they have at best they can?
Absolutely. You have to brush your teeth. That's the most important thing, and do it thoroughly. A lot of people have dexterity problems as they get older, so sometimes picking up a automatic toothbrush, I recommend the Sonicare toothbrush if used properly. And I say that definitively because we have people that have them but don't use them right. So we train them how to use them. Is a great piece of equipment that is well worth $100, $120. Another thing is that, gum tissue in the elderly tends to shrink back a lot and it creates spaces between your teeth. So sometimes a good piece of equipment is a water pick. And then a water pick can be used not instead of floss, but with floss. And it can be used with not just water, but maybe mixed with a little Listerine. So that can reduce the amount of plaque that forms. And it can also kind of blows out between your teeth so you can get some of the food debris out that's harder to get out with just floss. So those two pieces of apparatus, an automatic toothbrush like a Sonicare and a water pick are good adjuncts to whatever else you're using. Also, as the gum tissue does shrink back, it exposes some of the roots of the teeth, which are more susceptible to cavities. Many times I'll put patients on a concentrated fluoride gel or a toothpaste that has a more amount of fluoride in it, and that can also prevent cavities from occurring on the root structures of your teeth. So lastly, and most importantly, consistent professional care. Coming in every 3 to 6 months is really important. That's where the Toothboss discount program really is helpful. So keep that in the back of your mind. It's very important that you seek professional care 2 to 4 times a year.
So those tips are really good. We appreciate that. What about for those of us who are seniors and still vain and want to have super white teeth like the movie stars? What do you recommend?
Well, there's a simple bleaching technique that we do here in the practice. Uh, First of all, there's a lot of uh, advertisements for laser or light created light white teeth, and it's been shown in the research that really doesn't work. But they do charge a lot of money for it, sometimes up to $1,000. So we have a at-home bleaching technique that we provide here at the Toothboss, and basically what we do is we take impressions of your top teeth and bottom teeth and make models of your teeth and create custom trays and provide you with bleaching material that's actually carbamide peroxide. And the best use of that is if you can wear the bleaching trays overnight with the bleach in it. And that seems to work really well to get your teeth Hollywood white.
And obviously not compromise the enamel or the integrity of the teeth.
That's correct. It's very safe. Carbamide peroxide has been shown in the research to be very safe for that kind of use.
Okay. And so that segues nicely into my next topic, which is dental fear in general. I think that, it runs from children to seniors of folks who run into dental problems because they don't go to see the dentist. How do you allay those dental fears?
With my wonderful personality. Yeah, no, people get scared, but I think being calm myself is helpful. And I've been told that, that I've made people feel much more comfortable at the dental office. And, I'm not the best medical patient in the world myself. So I think of that often, and I want to make people feel comfortable. Now, the truly fearful, I can prescribe medication that will make it easier for you. I don't have to. I usually win people over and don't have to use meds, but there are a few that I have one young lady. She's not elderly. She's actually in her 20s. That as soon as I pull out the needle, she faints.
Oh.
So I started using some lorazepam the night before and then the day of, and it's gotten her through multiple appointments successfully without fainting. So there are ways to get around the fear factor. But again, I think if you come to the Toothboss, you'll find that the staff is very friendly, and we do have a calming effect on people. And after the first meet and greet, I think you'll feel much more comfortable.
I would concur there. As a patient, as an anxious patient, I know that I get so distracted by our conversation and sort of the general calming tone of your office that I have literally fallen asleep in the dental chair. So
well, that's nice to hear.
It's all good. And so while we're on that topic of sort of relieving anxiety, one of the issues for some seniors is they've returned to use of cannabis,
yeah,
also known as pot.
Right.
Do you have some advice about, cannabis and oral health?
It's the same for smokers, in general. It's it's going to dry your mouth out. It's going to, all the time dry mouth is the worst offender of getting cavities because the plaque can stick better to your teeth and cause more destruction that way. So you have to be careful, drink a lot of fluids, maybe even brush your teeth after you have a puff or two. But I can understand that. I have often wondered if it wouldn't be a good idea for me to provide that here for people, and for myself for that matter, on more of my anxious people that I get nervous about.
Well, it's
I can't do that. But
yeah, no, it's a work,
I think about
work in progress. Yeah. Okay.
Yeah.
All right. And then, sort of maybe you can describe an example of a senior who came to you and you were able to help them when they had some concerns, deep concerns about their oral health.
Well, I had a patient this week who's in her mid 70s. Hadn't been to the dentist in a while, very anxious about having treatment done, concerned about a broken front tooth that could not be saved. And so we got her in and we did what I call a comprehensive examination, which includes x-rays and documentation of what currently exists in the mouth and a good thorough evaluation of your gum tissue and also an evaluation of your home care techniques. And we came up with a treatment plan that included trying to get that tooth removed that was up front so that we could get something back in place that would make her feel better about herself, because this tooth up front that's broken and decayed was making her feel awful about her self-esteem. So we wanted to gear some of our treatment plan toward getting that rectified as soon as possible. So we're in the process of doing that, and I feel pretty good about that, and she feels good about it because she's moving forward. We haven't got the tooth replaced yet, but we started on she had some cavities and some broken teeth, so we're starting to work on that. And so that's the kind of patient that I like. We have a little mixture of, aesthetic concern, and then, certainly you want to save teeth that are broken too, even if they're in the back of the mouth, because those are your chewing teeth. So that's somewhat of what we do here. As well as, people that are elderly that have full dentures, we try to do the best we can. Even if they can't have implants to replace, we try to make as well a fitting denture as we can that they can utilize to chew their food, because that's very important in the whole health issue. So yeah. I think we're pretty successful at that.
All right. Well, I think we've covered the topic. I highly recommend you. I owe my radiant smile to you. And I'm wondering how others should be able to reach out to you. What's the best way to connect with you and potentially have an exam?
Well, the best way, of course, is getting on the phone or cell phone and calling the office. You can reach us at 781-335-0604. You can also reach us through our website. The website address is www.toothboss.com. And there is a contact form, and we're always aware of that. So we'll get back to you. And if you don't hear from us, you can call us on the phone and scold us for that.
Okay. Well, Rick, thank you very much for your time and your help throughout the years. I appreciate you being on.
Thank you, Steve. I appreciate you having me.
Okay. This has been another segment of My Generation, brought to you by South Shore Senior News. If you have a guest or a topic that you'd like to see addressed, please go to our website and drop us a note. Thank you for joining us today. Take care.